Hi everybody, I read The Omega Diet by Artemis Simopoulos. Artemis is definitely an expert in the field of nutrition. She got her medical doctor degree from Boston University, went on to found a number of nutritional organizations such as the World Council on Nutrition, which she is the chair of, in addition to the Center for Genetics, Nutrition, and Health, which is an educational organization in Washington, D.C. She then went on to do a bunch of different research studies. Most of her research was with regards to omega-3 and omega-6 fatty acid profiles, and specifically the ratio between those two types of fatty acids. She also looked into monounsaturated fatty acids, and she's been the author on more studies than I can even count. She first got her idea to do research actually from observing certain trends in populations around the world. She had noticed the island of Crete had a decreased risk in the population for cardiovascular disease, certain types of cancer, a lot of psychological disorders, and a few other really positive health benefits. So after observing that, she then compared it to certain other diets around the world where we've widely considered them to be successful and healthy diets, such as the Mediterranean diet, the Paleo diet, Japanese diets, and she found that the Cretan diet was actually more beneficial. So after this, she looked into it. She had hypothesized that the omega-3 fatty acid profile of these people was way higher than everyone else, especially when you compare it to like the US. And so her first hunch was that the wild greens on the island, purslane specifically, was very high in omega-3 fatty acids, and this was part of what was accounting for their overall increase in their fatty acid profile. So she collected the wild purslane, did the analysis, and found that she was in fact correct. These wild greens on the island are actually much higher in omega-3 fatty acids, especially when you compare them to the American diet and like mainstream agriculture. Something we do in the agricultural process removes a lot of the nutritional benefit, especially those omega-3 fatty acids from the plant products. So buying something in the store is not equivalent to going out and harvesting your own wild greenery. After doing this, she then went on to write her book, The Omega Diet. The Omega Diet references the Omega Plan, which has 7 main points, which is kind of the mantra throughout the whole book. Her first point is increase your omega-3 fatty acid intake. Not surprising. Second point, use monounsaturated oils such as olive oil and canola oil. Third point, eat 7 or more servings of fruit and vegetables. And fourth, eat vegetable proteins, so nuts for example. Fifth, avoid saturated fats. 6, avoid omega-6 fatty acid oils. Corn oil is a big one of these, especially when you look in the US. Corn products and corn oil have kind of permeated throughout our whole food supply. So you have to be really careful when you're buying anything in the store. Look at labels, make sure you're not buying corn oils. Lastly, reduce trans fat. That's probably the point that's most agreed upon in the literature. You won't find anything that's suggesting trans fats are positive for anyone. Saturated fats, there's some conflicting research currently on. There are some beneficial saturated fats. They are not all created equal. And it's also situational as well. Some situations you may want to increase saturated fat intake. So as a rule of thumb, these 7 points are very good. They do promote overall health, and she has a ton of research to support her claim, so I feel pretty confident following those 7 points. She goes on then to debunk a lot of the myths that are in American culture. For example, the high-fat craze that happened here. There's been a lot of the low-fat craze that happened here. There's been a lot of pushing towards, oh, you want a low-fat diet, like low-fat equals skinny, and the reality is none of that's true. Like, a high-fat diet doesn't mean you're going to have a high-fat body. A low-fat diet with high carb doesn't equal weight loss. So there's been huge myths about fat that have kind of permeated U.S. culture, and she kind of seeks to debunk a lot of those and talk more about healthy fats and what you can eat like that is high in fat and is good for you and will promote your weight loss. She also goes into the people who claim that they have lost weight doing this low-fat, high-carb type of diet, and references something called the bulk factor. So even if you are having this low-fat diet with high carb, if you're having certain foods that make you feel full faster and are low calorie, you still can lose weight, but it's not necessarily the healthiest way to do that. So she goes into that pretty extensively and then goes on to talk about individual foods and how they benefit our overall health. So olive oil is a big component of the Cretan diet. She talks a lot about olive oil and how the cardiovascular health benefits of it are extreme. It also has squalene, a compound in it, which lowers cholesterol, and something about the physiology of compounds within olive oil can stabilize the heartbeat, though that's not really well explained, and even the evidence is kind of confusing, I would say, with regards to that specific point. She goes on to talk about the cancer benefits of a high omega-3 fatty acid profile and high monounsaturated fatty acids. Omega-3s tend to slow cancer progression. Omega-6 tend to accelerate cancer progression. She also talks about how omega-3s may be synergistic with certain cancer therapies like chemotherapy, and that references a study where omega-3 fatty acid diet in addition to chemotherapy was actually more beneficial in treatment than either one of those alone. So there may be some synergistic effects that happen there. Flaxseed oil, she also referenced as currently being researched as a possible mainstream addition to breast cancer therapy. So this is pretty well acknowledged by the scientific community as a whole. It's not just some crazy out there idea. She then goes on to talk about certain psychological problems that can be alleviated by omega-3 fatty acid supplementation. DHA, docosahexaenoic acid, is a molecule that's created from omega-3 fatty acids. So DHA is the main structural protein within the brain. As a result, it's important for a number of different brain function. And it's also implicated in a number of different disorders, low DHA levels. ADHD is one of these. Depression is another one of these. And it was also interesting to note that alcohol abuse and chronic alcoholism can actually decrease your DHA levels, and then that would result in depression, which sort of explains the high correlation between depression and alcoholism. So that was just something interesting to note. After she goes through all this kind of review of systems and how this particular diet will help each system, she then talks about how to implement it in your own life. So she gives a 21-day menu with very individualized kind of menu options, and whether you're somebody that eats out or you're somebody that cooks or somebody that doesn't have time to cook, whatever it is, she goes into a couple menus for each person and kind of caters to needs on how you can adhere to this sort of a diet and keep your same busy or relaxed lifestyle, whatever you have. She does use the BMI calculation in order to determine caloric intakes, which is pretty good. It's a fast and easy kind of way to do it. Obviously, BMI isn't perfect, but it's an easy calculation, which is useful for somebody to do on their own. Overall, I would say that the book was very beneficial, very good source, especially for somebody who's not looking at it from a scientific perspective. Like for a lay person reading the book, she explains it in a very, very effective, efficient way, and has a ton of research to support it. The reference pages go on for days. So very qualified individual, very knowledgeable on the topic, and I'm definitely happy that I read the book and I gained a lot from it. The only issue I had was referring to cancer kind of as a broad category, because cancers are very complex. It's very difficult, even within, let's just say, breast cancer, it's very difficult to say every breast cancer cell type is going to respond the same way. especially when she's talking about monounsaturated fatty acids. Olive oil is very high in something called oleic acid. Oleic acid has shown very different behavioral patterns with certain cancer cell types. For example, with highly metastatic, very aggressive breast cancer cell types, oleic acid gets hijacked as the main source of energy. So you would want to avoid oleic acid with that type of cell type. On the other side, if you have a less aggressive cancer, still talking about breast cancer, oleic acid actually has inhibitory positive effects for it. So recommending something as a overarching global solution to cancer is always kind of dangerous. It's very tough to say that since each cancer is so individualized. So if I had to pick one thing that I sort of disagree with, I guess it would be her stance on cancers with regards to this diet. Overall, great book. I definitely recommend you guys reading it. And if you have any individualized questions, I'd love to answer them as best I can. Thanks.